Good afternoon. I'm here with Nicole Sherrard-Freeman, who runs our Detroit at Work program, and of course, Denise Fair. We'll start where we normally start. We have now lost 716 of our fellow citizens, and the number is still hard to fathom. The number is 87 higher than yesterday, but those of you who have followed the statistics aren't going to be surprised. 87 people didn't die yesterday. There are dozens of cases that were a week or weeks old, some of them back to March. And I thought the media did a nice job when we had 18 reported deaths on Saturday and 15 on Sunday to recognize that weekend reporting is not reliable. It wasn't that there had been a big drop. And so over the last 4 days, we've been averaging about 36 deaths a day, about the same as last week. And so we didn't dip over the weekend, and we didn't increase yesterday. But what has happened is we have hit a plateau. I looked at the data from the hospitals today on occupied beds and vents, and from Saturday to Tuesday, they're almost exactly the same. There are plenty of empty beds, there are plenty of available ventilators, but they haven't been dropping in the last 3 days. They've leveled out. Over at the TCF Center, they now have 17 beds occupied out of the 1,000 that are there. And so what we are looking at now is we went up very fast, we started to come down, and now we are at a flat level. And if you look at those numbers, it's very clear that Governor Whitmer's decision to extend the stay-at-home order was clearly the correct decision. We have not rid our communities of this virus, and it's going to be harder now to knock it down below that plateau level. And there's no doubt in my mind the way we're going to have to do it is testing people without symptoms. I don't think there's any question right now that the coronavirus that's still being spread in the city is being spread in significant part by people who don't think they're sick. We now understand this a whole lot better than we did 6 weeks ago when we were being told don't wear a mask because there's a lot of people who have the virus who are spreading it and don't even know. And so we're going to continue to encourage everyone in this city to keep wearing a mask. We have got to push this virus down much more than we have. The key to this is going to be the testing of people without symptoms. And so we announced last week that Detroit's going to be the first city that's going to test people without prescriptions, without symptoms. And we opened it up not just to city employees, but to companies whose employees have to come to work in this town. And today, after 24 hours, we've had 140 companies sign up with 5,000 employees who are being scheduled right now at the fairgrounds, and they'll be seen over the next week or so. Nearly half of those 140 companies are food handling companies, grocery stores, and restaurants, the exact people you would want. But it's also interesting to see who else signed up. We had daycare centers, we have doctor's offices. The employees at the TCF Center signed up. When you think about the folks who do not have access to testing, it's a little concerning, but the one that surprised me the most was the U.S. Postal Service called. And we are scheduling 1,000 postal workers in for tests at the fairgrounds. If you think about our postal workers going door to door in this community and not being able to be tested, it really shows you how hard it has been to beat this virus when you don't know who has it. But the city of Detroit is pushing forward. These 5,000 folks will get scheduled. I've been, for the last 48 hours, on the phone with labs across the country. And I'm confident by next week, by the middle of next week, we'll be testing 1,500 people a day between our Abbott kits and between the fairgrounds. We're reaching agreements with labs and agreements with suppliers And we are going to get every Detroiter tested who wants to be tested, whether you have a symptom or not. That's the direction that we're headed. And with what's coming in today, we're moving in that direction. And so I say to anybody, if you have to go to work at an employment center at the city of Detroit, have your boss call, the business owner, the manager, call, and once your company is registered, you will get a code as an employee of that company. You can book your time, you come out to the fairgrounds, we'll get you through, and we'll get you results in a matter of a few days. So you'll know that when you go to work at your company, your fellow employees are all COVID-19 free. It's the same kind of intensity that Denise Fair and the health department staff have brought to the nursing homes. And we're now about 2/3 of the way through testing every nursing home resident in the city of Detroit. We will be done by Thursday. I'm glad to say the rate of positive testing, which had been about 30% before, has dropped down to about 26%. What that tells me is that the health department did a really good job of getting to the problem nursing homes first and getting help there. As we move through, we're finding nursing homes that have very little in the way of COVID-19 problems, but we are going to be able to tell everybody where they stand. I am really pleased that Dr. Robert Redfield, the head of the Center for Disease Control, has just sent us today 4 staff from the CDC to join Denise Fair's health department in this nursing home initiative. I've talked to Dr. Redfield twice in the last week. He has been absolutely supportive of the city of Detroit, and we're showing now 124 deaths at nursing homes. I'm sure that number is dramatically understated when the data starts to catch up. But Dr. Redfield has taken this as a huge priority, and now the 4 CDC staff are here with the health department. And today, Dr. Jonae Caldoun committed $300,000 to our outreach as well, and I think the state intends to use Detroit's intervention with the nursing homes in this city as the model across the state, because you've seen it in a lot of other cities. If you can't do rapid testing, you have no way to fight the spread of the coronavirus in these nursing homes, and it's got to be expanded, and we're going to keep going until we get there. Before we get to Denise, we have been having calls to the office. I didn't get my $1,200 stimulus check. How do I get it? People don't know that even if you haven't made any money, even if you didn't file a tax return, you are very likely still entitled to that $1,200 stimulus check. And we want to put that money in the hands of every single Detroiter who's entitled to it. And so Nicole Sherrod-Freeman has developed an entire method to make sure that everybody in the city who's entitled to the stimulus check can get it, and everybody who's entitled to unemployment benefits can get them. And at this point, Nicole will explain to folks out there so you can tell your friends, you can tell your relatives who haven't gotten their check how they can go about it. Nicole?
Thanks, Mayor. So, as the Mayor said, 2 important updates to share. The first is on the stimulus checks, and then a second update for unemployment insurance payments. So the first, on stimulus checks, we know that some Detroiters have already received their checks. For those who haven't yet, though, the mayor and the city want to be sure that you have up-to-date information on how to apply and how to get your payments quickly. So the first thing to know is that the City of Detroit website has a button on it, and it's called Get Your $1,200 Stimulus Check. So the first thing to know is go to the City of Detroit's website, click on that button, and all of the rules and the forms that you need and the tools you need to get your $1,200 stimulus payment from the IRS are on that website. So if you, a couple things to know. So if you didn't file your taxes in 2018 or 2019, either because you haven't gotten around to filing it yet, or you didn't make enough to file taxes, as the mayor said, you could still be eligible for your $1,200 check. If you need to change your address because you got a check last year, a paper check last year from the IRS, and you're now at a different address, you could have the chance to change your mailing address. You just got to go to the website, click on the button, and all the forms and processes that you need to do that are on that website. Now, we know that some folks don't have a bank account, don't have a prepaid debit card, and if you're getting a paper check from the IRS, it could take up to 5 months. And so the city wants to be sure that you have an opportunity to get your stimulus payment as quickly as you can. And so to do that, the mayor has done a couple of things. The first thing is there's a list of 7 banks, including First Independence, Flagstar, Bank of America, and Chase, along with 3 others that are going to help you set up a bank account, either online or if you go to the drive-up window at any of those banks. You should call ahead to be sure you bring all the documents you need. But they will help you set up a bank account so that you can get your stimulus payment as a direct deposit, because that's going to be the fastest way to get to the money. All of the 7 banks who have signed up to do this for Detroiters are all meeting the Bank On standards, so they're safe and they're affordable accounts. But again, that's going to be the best and fastest way. And that list of 7 banks is all on the website, all on the city's website. The second thing is there are some folks who don't want a relationship with a bank, and they're going to get a paper check, and you're just fine with that. That's fine. You need a place to cash that check. And so what the mayor has worked out with JP Morgan Chase is that if you take that paper check to any JP Morgan Chase branch and you take 2 pieces of identification, they're going to cash that check for you without any fees. You got to have your ID when you take the check in, but they will cash your stimulus check for you for free. Now that only applies to your stimulus check, so it doesn't apply to any other check. But again, if you've got a paper check and you need to cash it, don't pay fees. Go to JP Morgan Chase and they'll cash it for you for free. The second brief update I want to give you is on the unemployment insurance payments. So 3 things I want to tell you quickly. The first is a couple of weeks ago, the governor expanded eligibility for unemployment insurance. And basically that means that people who weren't eligible before could be eligible now. So if you worked a part-time temporary job, if you haven't worked in a while, if you worked for yourself, you should go and apply. So go to michigan.gov/UIA, and that's where you apply for your unemployment assistance. The only exception to that is if you are one of the few Detroiters who is on Social Security disability, you're getting survivor's benefits, or if you are receiving SNAP benefits, be sure to talk to your case manager first, your HHS case manager or your Social Security Administration case manager, because you don't want your unemployment insurance payment to make you ineligible for those programs. But for the majority of Detroiters, if you haven't worked in a while, again, we're part-time temporary, go to unemployment assistance, go to michigan.gov/UIA or call 866-500-0017 to apply. And last, one bit of good news, I know the the unemployment insurance agency has been really backed up on calls and web traffic. They have now reserved Saturdays from 8 a.m. to 2 p.m. for folks who typically don't have access to the internet. So call on Saturday and apply for unemployment.
All right. And Denise?
Okay, thank you, Mayor. Now, I typically start with the numbers, but today I do want to share just a little bit about what we're doing at the Health Department to make sure that we are putting our nursing home residents first, our seniors. So as the Mayor mentioned, we're so thankful to the CDC for giving us 4 clinicians to help us fight this fight of COVID-19. The team is already here. In fact, I'm meeting them right after this meeting, and we'll be wearing my mask as I sit down with them and kind of talk about what our strategy is. So they'll be here for the next 2 weeks. They'll help us with not only our nursing home strategy, but also with our skilled nursing and assisted care facilities. So if you are a nursing director or medical director of a long-term care facility, then we'll be meeting with you shortly with the CDC team. So here are just a few ways that we're going to support the CDC as they support us with our work. First, they're going to help us to develop a strategy for testing and screening and cohorting the nursing home and skilled nursing facilities. The CDC will also help us perform site visits at our facilities, and they'll also educate us. They'll provide some train-the-trainer support for the Detroit Health Department. In addition, they're going to provide infection prevention control education for the staff and healthcare workers at the long-term care facilities and nursing homes. So this is really exciting for us. We really look forward to partnering with the CDC, and again, thanks to them. So as of today, there are now 7,904 cases and 716 deaths. I remain prayerful for those who have experienced loss at the hands of COVID-19. The Detroit Health Department continues to support and encourage all Detroiters and essential staff in getting tested for this virus. Now, you only need a prescription from your doctor and a ride to the testing site at the State Fairgrounds, and if you have neither, the city has made these resources available by visiting detroitmi.gov/health. Now, seniors in nursing homes, again, remain a top focus for the Detroit Health Department because in these communal settings, the virus can spread pretty quickly. Seniors are often at a higher risk from experiencing severe, life-threatening symptoms from COVID. So as an update for our progress on our 10-day on-site rapid testing initiative for all 26 nursing homes, we are on track. We have administered 1,282 tests to seniors and staff. We are now aware of 124 COVID-related deaths among both seniors and staff with an infection rate of about 26%. Now, in addition to our testing at nursing homes, we've also supported them with delivering PPE. We've delivered 12,000 N95 masks, 10,000 gloves, 150 gowns, and 300 face shields to nearly all the nursing facilities requesting this support. Thanks to our partnership with the city's first responders, medical students from Wayne State, and also our Henry Ford clinicians, so far we have visited 15 of the 26 nursing homes, and we have just a few more to go by Thursday, and we again are on target. As I mentioned before, the mission of the Detroit Health Department is to protect the health and well-being of the residents as well as the animals in our care, but we cannot do this alone. So I am always just so grateful to the mayor, to the council, numerous partners, and our residents in this massive effort. Collectively, we have stayed home, we have practiced social distancing, which I see daily at the grocery store and even at this press event. I know that we are continuing to disinfect surfaces, cover our coughs, and wash our hands on a regular basis. All of these efforts are working towards flattening the curve. Now, this pandemic has given us a window into what we can accomplish by working together. I am so proud of the Detroiters. I'm proud to be a Detroit resident. I'm also proud to be your health officer. So let's continue this partnership so that our children will have a brighter and safer, healthier tomorrow. Thanks, and I'll turn it over to the mayor.
We'll take any questions.
Mayor, we have a few questions from various media outlets regarding the nursing homes. I know that the number of deaths was mentioned, but do we have a number for the total number of cases, the positives at nursing homes?
26% times 1,200.
1,282 tests, and so as the mayor mentioned, times the 20%, it's...
Be 300 or so.
Sure.
We can get you the exact number, but it'll be right around there.
Also, they wanted to know whether we have a number of how many of the nursing homes were short on PPE that we ended up providing.
Several of them.
Yeah, I don't have the exact number, but everyone who we reached out to, they were more than welcome to receive the PPE. We've delivered to pretty much all of them. Yeah.
Okay, we can follow up later to see if there's a hard number. And one reporter wanted to know if there is, beyond the testing that's being done now and the interventions we've had, is there anything else that we can be doing, the city can be doing to lower the impact at the nursing homes and reduce the exposure and infections?
No, everything is about early testing, early results, finding out who's sick and who's not, getting the sick treated and get them separated. And now with the 15-minute tests, the nursing homes have the tools. They're following up diligently, they're separating, they're doing what they should be doing. A lot of nursing home patients have ended up in the hospitals. Some of them are at the TCF center and will ultimately go back to their nursing homes when they're fully recovered. But the nursing homes didn't have the ability to tell the asymptomatic patients who were infectious. And we're finding almost as many asymptomatic nursing home patients who had COVID-19 as those who were showing symptoms. And that's the reason you're seeing the nursing home deaths across the country, is because so many people have the virus and don't show symptoms.
Along those same lines, Corey Williams from the Associated Press was wondering if the initial lag in availability of testing may have played any role in the large numbers that we're seeing at nursing homes.
There's no question. It's the lack of rapid testing in America is the reason you've seen the spread of this virus. And again, I'm not blaming anybody, but the Abbott 15-minute tests weren't available till about 2.5 weeks ago to anybody. We got them first. But had 15-minute tests been widely available in this country in February, you would have known immediately who was infected, who wasn't. But most people were going to national labs, were overloaded, and you were getting test results back 6-8 days later. By the time you get the results 6 or 8 days later, it's a whole different group of folks have been infected. And so when the rapid tests are readily available in this country, we will really start to get a handle on this, and ultimately a vaccine will be required. But the faster Abbott can make kits, or the faster somebody else comes along with 15-minute tests that they can make the kits in a big way, the faster we'll really start to get this under control.
Okay, and last question on the nursing home topic is, are there any continuing issues with nursing home operators not being responsive to our requests? And
Not anymore.
okay. Channel 4, Priya Mann, is doing a story on COVID and the homeless, and she would like to know if you can give an overview on exactly how the process works, how frequently the testing is being done, et cetera, what happens between the times of...
So we should set up an interview with Arthur Jemison and Donna Rencher, who have done a remarkable job. But twice a week, nurses go to all 30 warming centers and homeless shelters in this city. They check on the homeless. They separate those who are showing symptoms into a separate building that we got specially set up with Detroit Rescue Mission. Those that test positive but don't need to be hospitalized go to another building being run by the Salvation Army. And our infection rate among the homeless in the homeless shelters is far lower than it is in the nursing homes. It has been extremely effective, the fact that Arthur Jemison and the team, right from the beginning of this outbreak, got medical help into our homeless community. And if Priya were to talk to Arthur, he could give her the exact numbers. And if she wants, I'm sure they would show her the facilities. But there's nothing I'm prouder of than the way this community wrapped its arms around the homeless and really did a good job of keeping the great majority of our homeless citizens healthy.
Question from WWJ: with additional testing sites opening in the region, how are you feeling about the overall testing capacity?
Yeah, it's helping, and it's put us in a position at the fairgrounds to do what we're doing now, which is, we're going to test 5,000 people right now who don't have symptoms, who are going to essential jobs every day. We couldn't have done that if the suburban sites hadn't opened and they hadn't taken a lot of the Wayne, Oakland, and Macomb residents out of the fairgrounds. We were happy to take care of everybody, but when they were able to do their own testing, it allowed us to dramatically ramp up the testing for Detroiters without symptoms. So it's going the right way. Your problem continues to be delays in test results. So I would say now, instead of doing 10% of the testing we should be doing in this state, we're probably doing 20% of the testing we should be doing in this state.
Last question for now from reporters who are watching remotely. ML Elric was asking about the retest question essentially. So if someone gets tested negative, and then a few days later, how do we know if there's been an exposure? Do they need to be retested?
Right. And so depending on where you are, if you tested negative and you're in your house by yourself, the chances that you were so early in the infection that you had it are pretty low. If you test negative and you're a postal worker, 2 days, 3 days, 4 days later, you could be positive. When we start to reopen more of the workplaces in the city of Detroit, we're going to be doing regular testing of our employees to make sure that they are negative and remain negative. But regular testing has got to be a key to reopening this economy. It has to, and it'll certainly be a part of reopening the city of Detroit.
Jim?
It's the hardest working man in local news.
Thank you very much. Good to see you all again. Jim Kurtzner with Channel 7. Follow up a question from yesterday. Have we gotten any closer? You're talking a lot about the nursing homes.
Yeah.
Finding out, you said there were, I have in the notes in my vehicle, 125 deaths in nursing homes. Are you able to now release, are we any closer to releasing where those hot spots are?
You made a really good point yesterday. We've gone back and talked about it, and so we're going to finish up all of the testing on Thursday. Our intention is to give a full report on Monday, listing each of the nursing homes, the infection rates, and what we know about deaths that originated from them. And assuming the state of Michigan doesn't order us not to, our intention is to give you a full report on all 26 nursing homes on Monday.
Very good. Nicholas Hood III has posted some pictures that he did an outdoor funeral this past weekend, where you see the casket outside of a church and 10 chairs. It's pretty remarkable when you actually see that picture. Have you seen that? What runs through your mind?
It had how many chairs?
10.
Yeah.
Outside, it was a nice day, it was warmer weather, but it was an open casket out in front of a church for a small outdoor funeral service. Just a remarkable picture to see. You have not seen it?
I lived that picture myself 3 weeks ago at the burial site when we buried my father, and it was 10 people around the casket going into the ground. It is very difficult to mourn the losses right now for everybody, but I haven't seen the picture, but I felt like I lived the picture.
Absolutely. Have you been tested? A lot of talk about testing. I believe you'd mentioned once before you had been tested. Have you been tested again recently? Or how many times?
So I got tested the first couple of days. The Abbott test came in, as did everybody on the 11th floor of the mayor's office. Everybody tested negative, and we've been in masks ever since. So I'm sure I'll get tested again at some point, but at the moment I want to get the firefighters and the police officers through. But if you were on the 11th floor of City Hall, you would see everybody's in a mask, everybody's separated, everybody's washing. It is absolutely possible to go to work and be safe if you're committed to these protocols. And you, I have no doubt, are you in the newsroom when you go
Never.
back? No, you don't go into the newsroom. But if everybody in your newsroom were spaced out and were as diligent as you are, you'd be fine.
There are very few entering that building, and I think that's true with all of the stations right now.
Yeah.
Minimal number, most of us working remotely. Last question I have is, there was an event in the city apparently on Sunday that's being called Sunday Funday that turned into quite a gathering. There are some videos that have been posted on social media. Do you have any idea how many officers it took to break that up? There was even some talk about using the police helicopter.
Again, Chief Craig didn't mention it to me, but we could ask. So I'm sure it was broken up without incident, or the chief would have called me. But this is the first time hearing about it. We're finding this over and over, though. It doesn't take very long. As soon as people start to come together, somebody picks up the phone and calls the police department, and the police are out in no time. So I hadn't heard about this particular one, but I would be very surprised if it's been any different. In nearly every case when the police show up, people are cooperative and break it up. And we're seeing fewer and fewer of these because they know people in this city understand what COVID-19 means to members of the black community. And when they see their neighbors being threatened by these types of gathering, they're calling the police, and the police are there. But you'd have to ask Chief Craig about that incident. I had not heard anything about it.
Thank you. Just a couple more questions that have come in, and this has come from a few different media outlets, so we should probably address it. That report out of Cleveland questioning the accuracy of some of the Abbott tests in certain applications. If you could address that again.
So this is the same question I answered the other day. The University of Pittsburgh Medical Center did tests that showed that the Abbott tests are as accurate as any other test if you take the swab and you put it into the Abbott machine. If you test someplace else, you take the swab, you stick it in what they call viral transport medium, take it to the Abbott machine and then put it in, you get false negatives. That's what the University of Pittsburgh Medical Center showed, and as I explained the other day, we have never followed that process. We never stick the Abbott swabs into medium because we know it doesn't work. Cleveland Clinic just released a report. It said if you put the swabs in the viral transport medium, you get false negatives. We say, we know that, which is why we have not done it at any point. So I know this may seem confusing to folks, but we completely understand the national research and the practice that some places used of testing remotely and sticking the swab in medium and then taking it to a vial. We have never done that, and that those reports that said the Abbott test doesn't work in that case, they're accurate, but we've never used that process. And the University of Pittsburgh Medical Center says the process we're using are as accurate. And I got to tell you, any test at a hospital or any place else has a 90% accuracy. So even the hospital tests are missing COVID positives 1 time out of 10. So that's a reality that we're all dealing with, and if you talk to any doctor, any nurse who works at a hospital, they'll tell you about those stories. But 90% accurate is the best we have to work with right now, and it's what the country's working with.
Okay, and last question. Annalise Frank from Crane's Detroit Business would just like to know how this deployment of the technicians from the CDC came to be. Did we approach them?
We did. I talked to Dr. Redfield. Denise Fair made a formal request to the CDC, and I think they've been extremely interested in what we're doing here, and you could talk about how you got the news.
Sure. So I think it's so wonderful that we all know that it takes a village. So it's not just the Detroit Health Department, it's not just the fire department, it's not just the residents, it's everyone coming together. The CDC was very open to us first having a conversation with them. We requested EpiAid, which is a way for the CDC to provide immediate access and immediate support to the health department. So we just found out, I think on last Saturday, and share the news with the mayor. And again, they're already here at the health department. They'll be here for about 2 weeks, and we're really excited to work with them.
Okay, that was the last question.
All right. Thank you all.